My name is Bill Clark. I'm an orthopedic surgeon. So I've been in practice here at this office for 25 years and loving it. I was born and raised in Seattle, and other than a few short stints in New York and Boston and California, I've lived here all my life. I love the Pacific Northwest. It gives me the opportunity to do everything that I like to do outdoors, and I'm kind of a sports jock. My wife says I do a little too much. I have a family of 4 with 2 boys that are now freshmen in college. They're in different colleges. My wife's a dermatologist, and we met in medical school about 30 years ago. And we recently just got a new dog. Well, for me, medicine is a perfect profession. I've always loved science and biology, and I like working with people. And medicine combines both. And in addition, it gives me an opportunity to maybe help some people in their lives, which is very gratifying. I chose orthopedics partly because that's what jocks tend to go into in medicine. But more importantly, I think the musculoskeletal system is fascinating. And although I like to see all patients, especially if there's someone that injured themselves in sports, whether it's a ruptured tendon or broken bone, I love to be able to fix that and get the patient back on the field or back into the mountains or whatever they like to do. It's very gratifying. I have a special interest in hand and upper extremity surgery. I first became interested during residency while doing research on nerve repair. I did a special one-year fellowship at Harvard, and since that time it's been the focus of my practice. I think the hand is an amazing structure. It's got almost 30 bones, 12 tendons, a lot of complex nerves. And without the hand, it's hard to work, and it's hard to do just about anything in life. Treating patients with hand problems is very satisfying. Well, I think the most important thing is to establish a relationship with that patient, like in any branch of medicine, and understand why they're coming to you and what their problem is, what bothers them, what's hurting. And then making the correct diagnosis is often the tricky part. Sometimes there are multiple things going on and multiple areas of pain, but narrowing it down so that you can figure out what the actual problem is allows you to give the right treatment. And this takes time, and it really takes good listening skills. And you have to know what tests are the best to order. And once you figure that out, then that's half the battle. And then I think it's important to involve the patient in your decision making. Give them the right options. Sometimes patients want a quick fix, which is fine. Sometimes they're looking for a permanent solution, which might be harder and take more time, but it's the best thing to do. But I think making sure that you understand what the patient's looking for and what their goals are key. I think it's a collaborative process, and that gives the most successful outcome. Well, I think it starts with making the correct diagnosis and identifying the correct problem and doing the right operation. That's half the battle. Of course, having a good set of hands and being technically proficient is crucial, and having the knowledge of the anatomy is important. I think that being prepared, when I have a complex patient, I'll make sure that I review everything, what's special about that patient's particular problem, the fracture, what might be necessary, what might be unusual about this person's case. It comes down to just about anything. Being prepared leads to success. And I think that even when you're as prepared as you can be, oftentimes you'll run into unknowns. You have to be prepared and creative to figure out different solutions and think on your toes. And I think that's part of being a good surgeon as well. But I think the most important thing is taking pride in your work. I think taking pride in your work really makes you a lot happier in whatever you do. And I love what I do. We cover all orthopedics. We can take care of anything. I think we're the perfect size. We all subspecialize, yet we're small enough to be personal. The office staff has been consistent. We have a very low turnover rate, and everybody likes working here, and that reflects. Patients can see that. We don't use PAs. We put on our own cast. We see all our own patients for pre and post-op visits. We're kind of old school. We don't use computers while we're seeing a patient. We spend a lot of time face-to-face. And we don't send patients away until the problem's fixed. We see them from start to finish. I've been here 25 years, and I've seen patients and their families, sometimes their kids, and that's very gratifying. I think we all love working here, and it shows.